Following the National Mental Health Commission's recommendations and the subsequent support of these recommendations by the Australian Government in 2015, PHNs around Australia have been developing mental health stepped care models in line with this nationwide reform to deliver more flexible mental health services. So we're continuing to fund mental health services, but in a way that's more responsive to the needs of the individual. Stepped care is an evidence-based and staged system of care that includes a range of mental health interventions from the least to the most intensive and matched to the individual's needs. Our mental health stepped care model is a consumer-centred model that's tailored to each individual and integrated with physical health and social services with an emphasis on recovery. The model is for all consumers, from young people to seniors. Our mental health step care model keeps GPs at the centre of the consumer's care and ultimately aims to improve outcomes for consumers with mental health issues in our community.
When we talk about growing the mental health of our nation, new mental health step care models are key. Stepped care in mental health is user-centred rather than provider-centred. It's about putting people and their families at the centre of their care. Step care has an emphasis on collaborative care, team-based approaches, putting the person at the centre of their care while maintaining an important role for the person's GP and other health providers.
Following a painful breakup, I started drinking alone, more and more every day, bit by bit, and I started to develop anxiety. And it was just a very slow and progressive decline. Anxiety turned into panic attacks, turned into an impossibility to work, turned into me joining and hitting the bottle more and more to try and numb the pain and the anxiety and the struggle, and it was a very lonely journey.
Mental health step care is about shifting the focus of care towards earlier intervention for people with their mental health problems, emphasising recovery. By responding earlier, people's mental health difficulties are less likely to become chronic and severe. They're therefore less likely to use hospitals and more intensive-based interventions at a later stage. Using information about a person's individual levels of need when they're presenting for care, their current symptoms, how they're functioning, their current mental health problems allows us to categorise their disorders into clinical stages. Based on the clinical stage, mental health support options can be matched precisely to the person's actual needs. For example, a 15-year-old dealing with depression for the first time requires quite different supports to a 40-year-old who has chronic depression, alcohol abuse and lots of other life difficulties. Having a good understanding of a person's needs and their recovery goals ensures care is more personalised and tailored. It ensures that people get the right care at the right time, the right level of care. Mental health step care involves a holistic or whole of health approach. Mental health issues rarely occur in isolation. Mental health care, step care addresses not only a person's mental health needs, but their physical health, alcohol and drug issues, other family and social areas, and most importantly, their level of functioning. Are they in education or employment? To provide more personalised care, you've got to do this at scale, not just for one, but for lots of people. That's why mental health step care includes eHealth technologies, new apps, new web-based systems, new digital technologies that allow us to assess, monitor and closely follow outcomes of care.
I've had appointments where the GP was there and the mental health practitioner was there together. There's a real holistic approach which has been absolutely brilliant.
We are in a period of great change in mental health service reform in Australia. PHNs now play a central role in service development. Regionally, they bring together the local perspectives, funding streams and governance so that people in your area get the right care at the right time.
To find out more about Eastern Melbourne PHN's mental health stepped care model, visit our website or contact our referral and access team.